An estimated 100,000 Americans died of drug overdoses in 2021. It was a never-before-seen milestone that health officials say can be tied to the COVID pandemic and an incredibly dangerous drug supply. Well, here in Metro Louisville, it's a battle health officials continue to fight. To learn more about the numbers and help available, we turn to U of L Health's Kelly Griffin. Thank you so much, Kelly, for coming on today.
Absolutely. Thank you for having me.
So let's start with some of the numbers. How did the rates of substance misuse really change during COVID?
Unfortunately, they've gone up. We have seen record numbers, especially alcohol abuse, and it's all tied into the anxiety, depression from isolation, financial issues. It's been quite a staggering increase.
The numbers just getting worse, exactly what you don't want to hear. Well, what are the substances that are really hitting Metro Louisville hard?
The biggest ones and the scariest ones, fentanyl, heroin. Fentanyl is one of those things that they cut into other drugs, and a lot of times users don't realize that fentanyl is in those drugs. It can be highly addictive, and it interrupts breathing, and so you get more overdoses because of it.
Really scary stuff there.
Absolutely.
We definitely want to make sure, though, we let people know that U of L Health, Mary and Elizabeth Hospital, offers this voluntary inpatient detox unit. It's for patients with substance use disorder. Tell us a little bit about it. What makes this spot so special?
You know, we found out that the zip code that Mary and Elizabeth Hospital is located in is the highest overdose percentage of deaths in the state.
Wow.
We found that out a few years ago, and when our CEO found that out, she decided we wanted to help the community, so we opened this detox program. The detox program at Mary and Elizabeth is a little unique. We tried to cover things that weren't covered by other programs. So it's voluntary, it's not a locked unit. We also do methadone detox, which a lot of other places don't. It's in a hospital, so patients have a little more privacy, and they can say, I'm in the hospital, instead of, you know, the stigma that sometimes comes, unfortunately, with mental health facilities. We also provide medical assistance for people who are on dialysis or who need oxygen supplementation, because a lot of programs can't handle those needs. Another thing, we have peer support specialists that a lot of programs don't have, and those are people who've actually been through that process themselves.
And important to note, with just a few seconds here left, do you have space available right now?
We do, and even if we don't, the ER will help take care of these patients until they can get up to the floor.
Wow, so there really is an open door here if someone watching wants to get a family in.
Absolutely, please come to the ER. You can also call 502-361-3731 for any information.
Kelly, thank you so much for coming on and spending some time with us today. We really appreciate it.
Thank you for having me.